So today was my pre-assessment. That's a standard procedure that everyone has to have before having an operation. You just go to the clinic at your surgery hospital and you basically answer a medical history form with a nurse, just basic things of what you're allergic to, what procedures you've had done in the past, and then I went through to another nurse who took my weight and my height and did a peak flow test because I've had mild asthma. Connected me up to an ECG machine just to check my heart rate, did my blood pressure, took some bloods, all fairly standard stuff, nothing to worry about. And today was probably the first time I got a little bit of a tear in my eye because, not because of what I was experiencing, but the nurse that I was seeing for the ECG and tests and stuff, Dirva, she got a message while I was in there to say that her mum was dying. So she had to take a moment just to compose herself. And I was lying there with my boobs out. And there was nothing really I could say. I just sorry and let her get on with her job. And yeah, it just I laid there trying to compose myself, but I ended up having tears running down my face when it should have been her, really. It was quite sad. Bless her. Just wanted to give her a hug, but she, like me, I guess, just soldiered on, got on with it. She had a job to do. After my pre-assessment, I had to go next door into the main hospital and see the breast care nurse. Sat with her for, must have been an hour. Because they said the whole appointment would take about an hour and a half, but it was nearer 2.5 hours in total. She basically went through everything that's in the breast cancer folder that they give you. She talked through all about the procedure, what's going to happen, what I understand of it. Talked about bras. I thought I'd done really well last weekend in TK Maxx. I'd found some really stretchy, comfortable, lovely crop toppy type things, but of course I've got to pull them over my head to get them on, and I'm going to need proper maternity style bras. I will film a little demonstration of them when I get one this weekend, but yeah, got to make sure that it's full coverage, keeps your boobs apart, nice and supportive, adjustable straps, and you can do it up as well, so it's easy to get on and off. There was lots and lots and lots that she talked about, all straightforward, all expected, but might have been because I had to get to the hospital for 8 o'clock this morning. I started to glaze over a little bit, when you sort of are looking at someone and you end up staring through them rather than looking at them. I don't know, I guess it's sort of, I had another of those moments today where you realise this is quite a big deal. I'm trying not to make it a big deal. It doesn't feel like a big deal. I feel really well. I feel fine. But when she's going into that much detail and that much depth about all the procedure and the aftercare and the risks and what could happen and things in the future and various appointments and all the things you've got to do to look after yourself, it just feels a bit much. A bit like they're making a mountain out of a molehill. And I was sitting there thinking, maybe I have underestimated this whole thing a bit. Maybe I am going to feel worse than I think. Maybe I do need the full 2 weeks off work after the surgery. Maybe I am going to feel bad. Maybe it's going to hit me at some point, and I don't know. I feel fine at the minute in myself. Not worried about it. at the start of this appointment, she gave me this checklist. It's basically an A4 page with lots of boxes segmented off to about emotions, physical worries. Basically, you've got to mark 1 to 10 in all the boxes of how distressed or worried you are about things. And I basically read through it all and handed her back a piece of paper blank and said, well, don't think I'm really very distressed about anything, I'm afraid. And she said, well, that's fine, you know. You don't have to feel bad about not feeling bad. Everyone feels differently. It's just there if you need it, sort of thing. I think that's the thing. Despite me sitting there and kind of willing her on a bit, thinking, you know, I don't really need this. The thing is, you might need it at some point. You don't know how you're going to feel down the road. It might hit you at some point, and you know then at least you've already been told what your options are, and that you know you've got that support network behind you, and you have all the answers to draw upon if you reach a stage where you have a question. You probably find you already know the answer. So it might seem a bit of a long drawn out process when you're sat there wanting to strangely get back to work. But it's worth it, and they're really nice. I said thank you because they are being so thorough and efficient and leaving no stone unturned, which is, you know, everything you would want in this sort of situation. And I shall continue with my flippant attitude. That is not to say I'm not grateful for anything and everything, but it's just my way of dealing with it, of just making it normal, you know. It's not a big deal. I can cope with this, carry on day to day, and take each part of the journey as it comes. But yeah, that's how pre-assessment went. See you next time.